Today's episode is an interview with Dr. Jerrica Dodd. She's a pharmacist, entrepreneur, coach, and leader. I invited her on the podcast because she uses her voice as a patient advocate and because she coaches women pharmacist entrepreneurs. You're listening to the Pharmacist Voice podcast, a journey-style podcast about my career change from pharmacist to voice actor. I'm your host, Kim Newlove. I alternate solo shows and interview shows. The solo shows are about my career change, and the interview shows feature a variety of people who use their voices to advocate, educate, or entertain. I specialize in medical narration and e-learning. If you have a project in mind, contact me through my website, thepharmacistvoice.com. That's thepharmacist with an S, voice.com. Thank you for joining me for episode 29. I'll tell you a little about my guest, Dr. Jerrica Dodd, then we'll dive right into the interview. Dr. Dodd earned her Doctor of Pharmacy degree from Florida Agricultural and Mechanical University, a Master of Science in Pharmacy Administration from The Ohio State University, and a Master of Science with a focus in Applied Pharmacoeconomics from the University of Florida. She completed her pharmacy practice and administration residency at The Ohio State University Medical Center. Dr. Dodd has been a pharmacist for 22 years. She transitioned into full-time entrepreneurship after a 17-year career in the pharmaceutical industry, where she had multiple roles within medical affairs. She has also managed a hospital pharmacy and has experience in retail pharmacy. Recently, she completed a nutrition health coaching certificate from the Institute of Integrative Nutrition, and currently, she is enrolled in the Institute of Functional Medicine. She aims to introduce a functional medicine perspective to the management of patients in her care at Your Pharmacy Advocate, LLC, where she is the founder and CEO. Dr. Dodd has also spoken on many stages across the country and is the proud executive editor of Pharmacist Magazine, which celebrates women in pharmacy. Dr. Dodd enjoys traveling, reading, teaching Zumba, cooking, and attending cultural events. With her background in pharmacy and leadership training, and her passion for people, Dr. Dodd enjoys encouraging people to be their best and to get the most out of every opportunity that life presents. Her favorite scripture is Luke chapter 12, verse 48. To whom much is given, much is required. And Dr. Dodd endeavors to live life giving back from the abundant ways in which she has been blessed. Without further ado, here's my interview with Dr. Jerrica Dodd. Hi, Dr. Jerrica Dodd. Welcome to the Pharmacist Voice podcast. How are you?
I'm great, Kim. How are you?
Doing great. It's great to see you via Skype.
Thank you. Yes, thank you. Good to see you too.
Awesome. My guests advocate, educate, or entertain. What would you say applies to you?
Oh, Kim, I do all three of those. I would say mostly I advocate and I also educate. With regard to being an advocate, I'm an advocate for patients that I care for in my pharmacist consulting practice. And then I also educate women pharmacists on how to pivot in their careers and build the businesses that will allow them to live a life that they love. And so And I also advocate for those women pharmacists because many times when they come to start working with me, they are not used to sharing their own voice. And so I advocate for them to become an advocate of themselves.
That's great. I didn't realize you only worked with women. Is that right?
Well, that's my target audience. I have had men inquire, and I definitely would probably do some different things with coaching a man pharmacist, but because I am a woman pharmacist and I know how my journey was along, getting to where I am today, I definitely feel that I can speak with women and I get them. I get pharmacists in general, but women tend to be the demographic that has been drawn to me.
Well, I think you're great. We met
Thank
a
you.
couple of years ago,
Yes.
and I feel like even though we're friends, we're not in a coaching relationship, you have given me some great advice since day one, since the first minute we met. Do you remember how and where we met?
I remember we were at a conference in Asheville, North Carolina, and we were at a crossroads of making a decision about which breakout session to attend. And you probably were standing near me and did not ask my opinion, but I wanted to help and said, well, I hope I asked you if I could offer a suggestion. And if I did or didn't, you graciously took the suggestion.
You are so close. It happened almost exactly like that.
Mhm.
We had been at the Metapreneurs Conference, so you're absolutely right, Asheville, North Carolina. It was April of 2018. I
Yep.
came into a breakout room. There were two choices. One was the advanced room, and one was the beginner room. I thought I should be in the beginner room, but I walked into the advanced room and I had that imposter syndrome. Am I in the right room? And I went and sat right next to you. I didn't know you, had never met you. And I said, I just sat there like a kid in a new school, like a new student. And I said, I don't know if I'm in the right room. And you looked at me and you said, well, what's going on with your business? Where are you at? And it was awesome. You asked me the right question at the right time. And because you asked that question, I was able to tell you, and you know things. You can tell things about people when you immediately first meet them. You have a gift. And you said, well, haven't you done all the stuff in that other room? And I said, yes, I have, but I want to feel like I'm solid on this. And you said, you need to go where you haven't been yet. You need to push yourself. This is the right room. You need to be here. And I looked at you like you were a wise owl. And I thought, well, I'm glad I'm sitting next to her. You made a great
Well,
first impression.
well, thank you. And yes, your memory definitely was able to provide more clarity to that situation. And I'm glad that that advice was helpful for you, because I do. If we were to rewind the time and we had that scenario all over, I would give you that very same advice, because I do believe that you have to hang out where you want to go. You have to align yourself with people that you can learn from and people that are where you want to be, because that is going to definitely give you that impetus, that drive, that push, that whatever it is that, with that lights that fire to reach further, because most of us don't realize what we're capable of until we're stretched. And then that's when we really see what we're made of.
Great advice. The challenges don't stop just because you slay one dragon. Am I right? There's
You're
always the
right.
next one. It
Yes.
pops up and you got to slay that one too.
Yes, I totally agree. When I was younger, my father used to say to me, every challenge or obstacle is just to prepare you for the next one. And, if you can imagine my elementary school brain, being in elementary school, I was like, well, I don't want any more challenges because I don't want to go to the next one. But unfortunately, I thought, can we just stop with the challenges? I'm good here. But unfortunately, that's not how life works. And I do believe that everything that we encounter, the people that we encounter, whether it's an experience of positivity or a not so positive, it's all for that journey that we're on, and it's meant to in some way teach us and prepare us for what's coming down the road.
I like that answer. Now, you have a number of roles you play. I know you're a coach, you're a leader, you're an entrepreneur. Can you tell me a little bit about all these roles that you have and what a typical week is like for you?
Well, yes. So as a coach, I coach women pharmacists, as I mentioned, to build a pivot in their career, or build the business that they want to continue in their career in. I also consult and care for patients from a functional medicine perspective, because I believe that oftentimes we can have, patients, or we know of patients that have been on medications for years, but we've not really made any traction in them being better, living better, having better outcomes with their health. And so that is something that is very important to me as well. And then as a leader, I often am called and asked for my opinion. I'm asked to speak. I'm asked to be interviewed on different podcasts. So I'm very grateful and I'm very honored to have the capability to function in all of those roles. And I take very seriously whether I'm taking care of a patient's life, whether I'm coaching a pharmacist, whether I'm working on the magazine, which I know that'll come up some in our conversation at some point. It's my honor to do what I do. However, I'm very grateful because I'm also living a life and I have a career that I have been able to fashion like I want it. Even though I didn't have this idea from the start, it has evolved into exactly what I want. And so a typical week for me can be any range of calls. It can be calls with a patient, calls with individual or private coaching clients. It can be a call or with a group of coaching clients. And I do have days in my calendar or times in my calendar where I'm talking with people about potential collaborations. I'm talking with people to find out what their services are, share what my services are. Is there a potential to work together? And so I do quite a bit of that, quite a bit of people, especially in the health and wellness space, who like to share what they're working on and to see, is it possible that it might be a good fit?
Could you share a success story with me? Somebody that you've coached?
Oh, gosh, yes. So I can tell you about one of my recent patients. And oftentimes when pharmacists come to me, they want to talk about being a consultant pharmacist and doing MTM. And one of the first things I say is don't say MTM to a patient because it's not going to mean anything to them. But because I'm very much an advocate of being a patient advocate, even as a pharmacist, and meeting the patients where they are and giving them what they need. And so I recently began working with a patient in January of this year, actually right before the pandemic and all of that began. And she is a diabetic patient who had seen her physician and had a hemoglobin A1C of 10.1 and was told that she really needed to make some changes. And so we began working together. And it's interesting that, when I start asking the questions and listening to her talk, I found out that her problem was that she was not eating enough and that she was doing quite a bit to invest in the care of her family and not enough in caring for herself. And so we really started working on her diet, from looking at, okay, you're going to a restaurant for a family celebration. Let's pull up the menu and let's talk about some choices that you would make in, going for this celebration. I also would speak with her about movement and making sure that she got movement into her life. And I would definitely talk about, monitoring her blood pressure and her blood sugar and, these types of things that seem really mundane to us because we just want to get in and manage the medication. Well, she didn't have any challenges with her medication. Her challenge was her nutrition, her diet, and her exercise. And so I felt that we should start there. And when we started there, 6 months later, we had a hemoglobin A1C at 6.3, or 6.3. So he's 10.1, 6.3. And I haven't tinkered with any medications. I haven't made any suggestions because there was nothing, wrong with the regimen that she had. But I'm a believer that we will eventually be able to either decrease or discontinue the regimen because we're starting to make changes in her life that are going to be impactful.
That is a success story. I know we focus on numbers sometimes. That tells us, it gives you insight into if you're making progress. And not only did you improve her numbers, but you improved her nutrition, the content of her diet, and her exercise. That's awesome. That's a
Yeah.
win all around. That's like 4 wins. Good job.
Right.
Good job to the patient.
Right. I'm very proud of her because we looked for options that she could employ that did not require her taking any additional medications but how can we just step back from life and look at what's going on, who's preparing the food in the home, who's shopping for the food. Let's look at things like that. And that's why I believe that as pharmacists, and I'm not trying to turn us into nutritionists or anything like that. However, but I believe that we have the trust of patients already as pharmacists who will share with us, I'm really not taking that medication the right way, or, I really have questions, but I didn't ask my doctor. And I just believe that we have a trust already built with patients, or it's really easy to build, that will allow us to help patients make meaningful changes in their lives so that maybe they might not even need the medication, because, we've definitely had our share of news with regard to recalls. And my sentiment about that is, let's get you healthy so that you hopefully won't even need that medication.
Right. I like that answer. How do your patients find you? You're not working actively in the community at a pharmacy, correct?
No, I have a health and wellness consulting practice as a pharmacist. And so patients find me either through my social media marketing. That's the best way to market, or one of the best ways to market. And then also I have patients that have had similar results. This patient that I spoke of was actually referred by another patient who is diabetic, who had amazing results and, an amazing loss in weight. And it was because of focusing on those areas and making some lifestyle changes that really, really turned things around. So that was actually a referral from another patient. And oftentimes it works the same way in my coaching business, is that I will work with a pharmacist. I actually got a reach yesterday from a woman who worked with the husband of a woman that I coached to get an MSL position in the pharma industry. And she reached out and said, this gentleman said you coached his wife, and I know she got a job. So are you able to speak with me and see if you can help me? So I think that word of mouth, which is why when I'm working with clients, whether they be a patient or whether they be a pharmacist or, someone wanting to pivot in their career or build a business, I give it my all, because I want patients and I want clients to win.
Very cool. Let's talk about clients who are pharmacists who want to make a pivot in their career. How do they find you? Is that also social media and referrals?
Social media and referrals. I believe that when you get to the point in your career and you get that itch, maybe it's just the itch of, curiosity. Maybe it's the itch of, I can't do this anymore. Maybe it's that itch of, I was made for more than what I'm doing currently, and I've got to find out what that more is. You will begin to look and go, I know that somebody out there can help me. And I don't mean to make it sound like some serendipitous way to find me, but I've been amazed at just having a social media presence and talking about, what I do, how I help, how I serve. It boggles my mind the number of people that say, hey, can I get on that calendar? Can I get on your, or just show up on my calendar because that link is out there. It boggles my mind how people have found me. And so I'm grateful that my reach through social media has been an opportunity to reach people that I didn't even know before, but who are obviously looking for a solution to their problem.
I want to ask you about the response that you get from people when they first meet you, that first consultation. Did they say the same thing that I said? You saw something in me that I didn't know about myself. Do other people say that, or is it just me?
No, other people say that. I actually just had that said to me yesterday. Most people will get to the end of our call and say, wow, this was not what I thought it would be, but this has been great, because I think that they are expecting some regimented, call where it's, question, answer, question, answer. But I really strive, which is why I love to use the virtual platform so that I can see the person while I'm talking with them and they can see me, is I really want it to feel like we're having a conversation. Like you said, we're like we're friends, although most of the time I've never met most of the people that I've talked to, but I have a very short amount of time, whether they become a client or not, I have a very short amount of time to build rapport and trust. And so that's why I think being able to see people definitely helps while you're talking with them. But yesterday, I was about 20 minutes into a call and I sat back and I said, I know you don't know me and all I know is what you've told me. But from what I'm hearing A, B, and C, and it probably came from either one or both parents growing up before the age of 18. And she paused and she shook her head and she goes, "You're absolutely right." And literally all I had heard, I've never spoken to her before that call, but all I had heard was 20 minutes of conversation. And usually if I'm asking a question and I can't seem to get like a direct answer, I'll, come in the back door, I'll ask it a different way. But either way, I was like, this is what I'm seeing. And, I hope you will oblige me in allowing me to share what I see. And she said to me, "You are absolutely right."
You have a gift. Has anybody ever said that to you?
Yes, ma'am. Yes. Yes.
I believe it. Do you believe that too?
Oh, yes. 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 I think sometimes as you can see me, obviously the listeners won't be able to see the visual part of our conversation today, but you can, and you can even see my response, even when you say that, in that, yes, I've definitely been told that many times. I think I had that nonverbal response that I did when, I kind of looked down and like, yeah, is because sometimes I forget and I'm just being brutally honest and saying, you know what, let me just tell you what I see here, whether you've asked me or not, which is why I said, hopefully I asked you if I could share some my suggestions with you. But usually, which is why I endeavor to build that trust and rapport, that people will allow me to speak into their life. And, sometimes, they may or may not be ready to hear that, but my hope is that they'll think about it. And it's not, meant to be indicting. It's meant to be, I want you to recognize this, because when you do, it will help you to meet this challenge whenever you pivot in your career, whenever you're building your business, because it just doesn't go away, if you will.
Jerrica, let's talk about your magazine. What is it called? How can people find it? What's in it?
So I know that the listeners can't see this cover, but this is what I'm holding up, because it's one of the things that I am so proud of, because it went from being an idea in my head and in my heart to in my hand in 90 days. And the name of the magazine is Pharmacist. It's a play on the word pharmacist. So Pharmacist, SIS. And the purpose of the magazine is to celebrate women in pharmacy. We profile, or what we feature in the magazine, is women who have had experiences in life, whatever that experience is. Maybe it's loss of a job. Maybe it's just feeling like I was made for more. Maybe it's, they reached a pivot in their life, a turning point. Maybe it's, due to something that changed in a drastic way in their family situation. But each woman profiled in this magazine made a decision that she was going to change her life. And so that's what has taken place here, in that these women have taken situations that could have definitely ended a lot differently and determined that they were going to turn them around and have a different outcome. And so I'm so proud and so honored to have had the opportunity to interact with each woman that was featured, that has been featured thus far, and looking forward to the upcoming feature in the fall of this year.
Very good. And where can people buy Pharmacist Magazine?
They can go online to the website. It's Pharmacist, S-I-S, mag, M-A-G.com. And there is a menu button there that when they click that, one of their options will say, get your copy. They can either do the actual, it's a soft copy, but they could do the hard copy version that they could hold in their hands. It makes a nice coffee table type book. It's definitely matte finish, full color, or you can do a digital download. And that is probably the quickest, easiest way if you just want to read it online on your computer.
I bought mine from Amazon.com. Yeah, so I have the first one. I need to buy the second one yet. And there's a lot to read in there. You do a very in-depth interview with each of your guests, each of the women that's featured in there. So kudos to you for having it be like a lot of content. You get your money's worth when you buy Pharmacist Magazine.
Thank you. It's my goal for you to read each woman's responses to the interview that I do with her, and that you really get a feel for who she is if you don't know her. Some of the people you may have already known, but if you don't know her, you can get a feel for who she is, what she's experienced. Because one of the things that I feel is so important is them share, each person, each woman featured sharing her story. Because in all of our stories, no, the details may be different. No, I don't necessarily have the exact same experience as someone else. But when we listen to each other's stories, we go, oh my God, I can relate to that. There's either something that you can relate to directly or indirectly. And that's the magic, if you will, that I wanted to spark, to say, these are women who are changing their lives, and you can too. Here are the details. And so I wanted you to feel that you got a good springboard for even knowing that woman pharmacist more if you'd like to follow up, which is why we put contact information. It's why actually on the Pharmacist Mag website, we also have a directory now. So every woman that's featured, even after that, feature has passed, you can still link to either her LinkedIn profile or her business website. So there's a directory there that you can go and, maybe seek them out for connection, to do business with them. It's really growing to be an awesome network. And I'm so grateful for the opportunity that I've had to feature each and every woman in that magazine.
Awesome. And just to review, 100%, they're pharmacist entrepreneurs, and they're all women, correct?
That is correct.
What an inspiration just to read that. If anybody out there is looking to be an entrepreneur, start their own business, inspiration is in Pharmacist Magazine. Check it out.
Thank you. Yes. I think that you truly won't be disappointed if you take an opportunity to read and find out about each woman featured.
And connect with them too, because a lot of women pharmacist entrepreneurs, I've noticed, are very generous with their comments. A lot of people help them out. They're willing to help out too. I'm not trying to promise anybody's time to anybody, but even asking that one question, how did you come up with your company name, for example, people will tell you because it's just one piece. And that was the hard stuff once upon a time, finding out, how do I get an EIN? How do I name this business? How do I set up this and that? How do I get a logo? If you just have one question and you reach out, it's not a bad icebreaker. Make connections. I know a lot of people help me. People ask me for help all the time. Even if it's just one simple question, I'm happy to help people too. So connect. I love that you mentioned that they have their social media and their website in that magazine. That's helpful.
Yes. And all of them, I know them all personally, because there's no one in that magazine that I don't have a personal, professional relationship with, if you will. And so I know all of them personally, and I would be surprised if any of them were not nice and willing to connect and, answer a question or two these are great women, and it's why I look for more great women to be a part, because I think that the profession can use the inspiration, but I also think the world can use the inspiration.
I second that. Nice. Very nice. My next question is a little bit more on a delicate topic. I want to talk about how the coronavirus and the topic of racial injustice has affected your business.
So as you can imagine, Kim, and thank you for asking that. If you can imagine, both of those topics have affected me personally. So, I've said to many, a potential client and client, how you do anything is how you do everything. So the things that show up in your personal life, they also can show up in your business. And so when I say that the coronavirus and the racial injustice, around the globe impact me personally, I've had, unfortunately, the loss of family members due to the coronavirus. I've had, experience with racial injustice most of my life. And so as everything has been happening in 2020 with, first the pandemic and then the global awakening and response to the racial injustice, if you can imagine, I had to sit for some time to think, where's my place in all of this? Because obviously I cannot save the world. I cannot change the world on a grand scale without first starting with what I can do, if you will. And so I really took an opportunity to take a step back from social media for a while. I took a step back and I had many conversations with many people. What's needed? What do people, I listened to the questions people asked me. And so from the coronavirus perspective, and then also from a racial injustice perspective, one of the things that I am very passionate about is the disparities within healthcare between people of color and other people. And so it's very important for me in deciding, where's my place in all of this? Number one, I encouraged every woman that I had profiled and featured in the Pharmacist Magazine to consider herself a leader, because she is the leader of her own company and she's the leader of her career. And whether we designate ourselves to be leaders or not, or whether we signed up for it, we are leaders. And to think about the influence that she has on her platform. And that platform is not only social media. We don't only have platforms for social media. We have platforms in many different ways. We have platforms in the fact that we have people that we can talk to. We have an audience of people that, like I had an audience of people calling me asking, hey, what's going on? What do I do? What do I say? How do I respond? So, but using whatever your reach is to be considerate of how you want to show up in the world and work towards the alleviation of these problems that our world is currently facing. I mean, I think that's what leadership is about. And so, and from a patient perspective, I have really, really thought, hard, how do I make an impact with regard to the racial injustice and the coronavirus in a patient setting? And so definitely encouraging my clients or our clients with your pharmacy advocate to support their immune system. We all found ourselves at home, and I'm the first one to raise my hand and say, yeah, I brought all the creature comfort foods I could find those first couple of weeks in the grocery store. And that's not good, because some of it, or I was going to say a lot of it, but some of it contained quite a bit of sugar. And so we know that that's not good for our immune system. And so just helping my clients to be aware of how to continue to take care of their health, understanding that if they are a person of color, that they could potentially be at a greater risk for what's happening with regard to the pandemic. And so helping them understand that their health has to be a priority, which, pandemic or no pandemic, that is, definitely one of my platforms. Your health has to be a priority, and it can't be someone else's priority before it's your priority. And then I also, I reached out to ASCP And I literally said, I want to reach out and I want to see what's going on. And because that's the organization that I've been more closely connected to with regard to pharmacy. And I asked, what initiative do you have? How can I serve? And a couple phone calls later, I ended up being asked to chair the task force for racial equality and how we're going to make some changes within the organization to educate and to bring awareness to the pharmacists that are a part of ASCP who are taking care of patients. And so that was something that I don't know that I'd necessarily gone out looking for. I was just saying, hey, how can I get involved? How can I serve? And so that's something that I'm really looking forward to being a part of and bringing about some change and awareness and education and also research such that when we continue having these conversations, we're able to look at specific events, milestones, and initiatives that help to work towards the solution to these problems.
For any of my listeners who don't know what ASCP is, could you tell us?
Sure, and I apologize. It is American Society of Consultant Pharmacists, and we're so used to using acronyms that we just throw them out there like everybody listening should already know. So my apologies for that.
Not a problem. You may have just introduced some students and some pharmacists who haven't heard of them to that organization. I'll put a link to that organization in the show notes. Jerrica, if someone wanted to work with you, how would they get in touch with you? Do you have just one website or is there more than one?
So the best way to get in touch with me is through my website, which is drjerricadodd.com. So it's DR for Dr. Jerrica, Jerrica, Dodd, DODD.com, drjerricadodd.com. There's a contact page on the website that you can send a message, or I do quite a bit of hanging out on LinkedIn. So I get a lot of messages from people that just send me direct messages, whether we're connected or not, and I'm happy to respond that way as well.
Very good. Now, when someone reaches out to talk to you, do they have an initial free consult or is it all, buying packages right off the bat? What's it like to work with you?
So before I talk about any package or any program, my goal is to truly meet, learn, connect, and build a rapport with the individual that's in front of me, because it's not so much my goal to sell them anything. It's my goal to hear, are we a match to work together? Number one, is that person coachable? Number two, can that person maybe receive coaching from me? Is that person really ready to build what they say they're ready to build, be it in their career or business? And I want to spend time hearing what the challenges are, what keeps them up at night, what the problems are, or the obstacles that they're facing. Because usually especially in the case of someone who is pivoting in their career or wanting to build a new business, usually this is not their first attempt. They've thought about it. They've maybe tried some things on their own that maybe haven't worked out as well. They didn't get an interview, or they didn't get the job, or they can't get this business off the ground. I want to hear what those challenges are so that I can, one, find a common ground and make sure that I have an understanding of what is going on. So in my opinion, I think it's an opportunity for us to see if we're a good fit for each other, if we're a match, if you will. So that first call is really just to find out those things. And if there's question about, okay, I think this is great, how do I work with you? How do I move forward? I definitely can share that information, but my goal is to find out who they are first and foremost.
That's a great way to get started. Then do they work with you once a month or once a week, or is it all just depends? It's all customized.
It depends. It depends on if we are working towards building a business, because you would be amazed at what you can do in a very short amount of time. It depends on their current status? Are they in in a current job and they are just looking to start building something slowly on the side? Or are they without a job? Do they need to make money yesterday? Those are different scenarios. And so, because if someone comes to me and they need to make money yesterday, then we need to address that first, because that's their biggest problem, if you will, their biggest challenge at that moment. And until we address that, it's going to be harder to say, okay, let's dream about what we want the name of the business to be if they need money, 911. So it really depends on where that person is, which is why I spend that time in that first call hearing, listening, because I think those are two different things, and understanding where we're going and what our challenges have been thus far. And so it all depends. It also depends on what works well for that person. Do they feel that they want an individual journey where they have my focus during the times that we're working together? They have my complete focus on them and only them and their business? Or are they more comfortable to be within the support of a group and have that community as well, because some people work better that way?
You're right. It's not a one size fits all, is it?
No.
No, that's great that you're sensitive to those issues. There are some people who have never been coached before, never even thought about being coached before. When I started signing up for voiceover lessons, I had never been coached before. And the price tag associated with it was scary, because I'm investing in myself. And if it doesn't work out, it's because I'm choosing to walk away. My coach knows what they're doing. So I just wanted to bring up to anybody listening to this who's never been coached before, it's worth it to find somebody like Jerrica who knows what they're doing and understands that people are coming from different starting points and different mental space. And that's okay, because not everybody is as strong right out the gate as others. And that's okay too. Every entry point into entrepreneurship is valid. You just have to get to the finish line.
Yes, I agree.
Is there anything else that you would like to talk about before we wrap this up?
Well, if I could leave any parting words, I spoke earlier when I was speaking about patience, and I said that one of the things that's most important to me and I'm very passionate about is patients being in charge of their health. And I'll say that because I don't know, the mix of your listeners, but I'm imagining there will be pharmacists that will be listening to your podcast. I am just as passionate about pharmacists living a life of their dreams. And, one of the things that I think we talked about even back in January is that somehow when we all went to pharmacy school and we matriculated, we graduated, we got our first jobs, we stopped dreaming. Because if you can think about before you went to college, people, when you were younger, people would say, what do you want to be when you grow up? That's a typical kid question that people asked you. And I'm sure you've asked, other children. But we stopped dreaming. We don't dream anymore. And so if you can imagine the magic that I see happen when I'm sitting in the same place that I'm sitting to talk to you, and I give people that I speak with the permission to dream again. Sometimes some people are so, shell shocked that they really are like turtles that withdraw into their shell and they refuse to dream. And they get very analytical and they start talking about right and wrong and good and bad. And I'm like, yeah, but this is like what's not possible. And I'm saying, but this is an opportunity. So let's go back and you have to dream. And so that's one of the things that I'm really, and I tell the pharmacists that I speak with, I am just as analytical as you are. So I've not, sailed off on some cloud somewhere and feel that I'm riding a magic carpet, but really you have to dream. Our dreams give us hope because, we talked about some serious circumstances that are facing our planet right now. And so our dreams give us hope. Our dreams give us the opportunity to envision what we want for our lives. And so it is so important for us to dream, because I would venture to say that for the pharmacist that feels like they're stuck, or they feel like this is not, what I thought I would be doing with my career, I don't feel fulfilled, whatever, fill in the blank, I would venture, to say that they've stopped dreaming. And so that would be the other, in addition to patients, if they can at all possible be in charge of their health first before they expect others to make their health a priority. I have that same passion and conviction on the coaching side about pharmacists and dreaming.
I love what you said. I was actually putting my hand over my heart and smiling big, because that is so true. You need to dream. Give yourself permission to dream. And if you don't mind my sharing a little bit about my story, I have a son with autism and a husband who, at least before he got released from his job due to a reduction in force, he traveled a lot internationally. I was the dedicated caregiver. You can't find reliable, affordable, skilled childcare with the snap of a finger. I have life circumstances, and I have certain things I want. I want to be home to cook dinner for my family. I want to be the support person for my husband. I want to be there to raise my own kids. These are things that I want. And I had to let myself dream, because being a pharmacist, being a peg in somebody else's hole, did not make sense to me anymore. I couldn't get out there and do the job because I had life circumstances. And it was hard for me to say, it's okay to do something else and use my identity as a pharmacist to do that. And I love that you were talking about dreaming, because I had to start dreaming again. You're absolutely right. What are my skills? What are my strengths? How can I use these to do something else? How can I start over and reinvent myself? And when you're dreaming, you don't necessarily think in those terms with those words, but you do dream. Mm-hmm. Thank you for sharing that.
You're welcome. And Kim, I think that we all get to a point in our lives, and I don't know if it happens in 30s, 40s, 50s for some people, different times for different people, but I think we all look up and we start to look back over our life at some point and think about, the decisions we've made, the things that I call those life cards, like what you described of your life circumstances. And I think that we are able to see how those experiences in life have shaped the decisions we've made, have shaped the outcomes and the results that we have. And I'll tell you this, one thing that I say, and sometimes it causes people to just really pause and go, as I say, you're either going to build someone else's dreams or you're going to build your own. And so it's not a bad thing if you want to be a support to help someone else build their dream and they pay you for that. That's not a bad thing at all. However, I don't think it's a bad thing. I know it's not a bad thing to build your own dreams. And I think it just depends on which one you prefer, because, yes, you could do both, I think, for a little while. However, when your dreams are so big that you run after them with reckless abandon, then I just think that there's just something magical about that. And even I'm so grateful for this opportunity to talk. I know when we talked in January, it was, off camera, off podcast, we were just catching up. Yep. I am so amazed and so excited for you as what I've seen even transpire between January and present day. So congratulations to you, and just even the changes that you've been walking through, probably more unknowingly than ever, but yeah, you're following your dream.
I love that you just affirmed my transformation, essentially. I went from somebody who was looking the other way at an opportunity that was staring me in the face to somebody who's doing something about that opportunity and moving forward. Thank you for your support. I really appreciate it. And thanks for coming on the podcast today to catch up with me and tell me about your business and your successes. I hope you have a wonderful rest of your summer and much success in the rest of 2020. Thank you, Jerrica.
Thank you.
Thank you for joining me for episode 29 of the Pharmacist Voice podcast. Please visit thepharmacistvoice.com to subscribe and read the show notes. That's thepharmacist with an S, voice.com.